Hello, my name is Dr.El-Zawahry. I'm a urologist and director of bladder health and pelvic floor reconstruction. In this video, I'm going to discuss about ureteral stents. These stents are very common to use in urologic procedure. Many patients have many questions about them, and hopefully this video will shed some light about these stents. To understand how does a stent work, you have to understand the anatomy of the urinary system. The urinary system is composed of two kidneys, two ureters, the urinary bladder, and the urethra. The kidney makes urine, and whenever the urine is made, it's going to be transported to the bladder. This is a function of the ureters. These ureters are small tubes that carries the urine from the kidney to the bladder. Once the urine is in the bladder is going to store urine, and when you are able to go to the bathroom, your brain is going to give the order to the bladder, and once the bladder takes the order, it's going to pump urine out to the outside world. So where is the stent going to be? The stent is going to be located in the ureter. The idea behind the stent is going to be acting as a conduit between the kidney and the bladder to bypass any blockage in the ureter. Remember, if there is any blockage in the ureter, this means it's blocking the kidney. And if the kidney is blocked for a long time, the kidney is going to start losing its function and is not going to be able to make urine anymore. And this is when people start to have problems with kidney function, and they lose their ability to concentrate and make urine, and then they end up with kidney failure. So the stent will be in that location to help to avoid this problem. So what are the stents? The stent is a very tiny tube. It's a straw-like tube or a spaghetti-like tube. It's hollow, and the length is about 12 to 15 inches. It has two coils or loops, one in the kidney and one in the urinary bladder. The idea behind these coils is to keep the stent in place. It's very rare when it migrates, but it's supposed to be staying in that location between the kidney and the bladder. The stent is to bypass any blockage and make sure that the ureter is patent and open so that it can transport the urine from the kidney to the bladder. So of course the question will be, when do we need to use the ureteral stent, and do we really need the stents? The answer for this is yes, we need the stents. And when do we need them? After any procedure that involves the ureter on the kidney through using the telescope, we will need to have the stent. The stent will help to relax the ureter and give it some time to rest. It's very important because the ureter can have swelling, can have some scratches and some edema, and in these cases it can cause some damage to the ureter. So the stent will help the ureter to heal very nicely. Also, if the kidneys are having any problems with blockage, when the kidneys are blocked, like what we mentioned, is going to cause damage to the kidney. So the kidney can be damaged by stones, scars, blood clots, cancer, infections, and in these cases, the stents will help to bypass the blockage and allow the kidney to drain properly to the bladder. At times, we'll need to have the stent before the procedure. So if someone comes with a scar tissue or a stent or infection in the kidney, and we can't do the management of the scar or the cancer or the stones immediately because the ureter is very tiny or because there is an infection, then we can put the stent. Again, remember I said it's going to help to rest the ureter and help to drain the kidney and keep the kidney in a good shape for us. When do we need to remove the stent, or how long does it need to stay? The answer to this question is up to your urologist. It's very important to discuss this with a urologist, and usually they are going to tell you that. However, you have to remember, These stents are not like hard stents. They are not forever. Usually stents need to be removed or exchanged within 3 to 4 months. And this will be discussed with your urologist. When we remove the stents can be removed by one of two ways. Either you are going to be removing the stent by yourself by pulling a string that's attached to the stent. That string will help the stent to be straight and come out easy and smooth. This will take about 30 seconds to 1 minute, and it does not cause any pain. It is little discomfort, but no pain at all. The other way is by the urologist, and this is a procedure that's done by the urologist in the outpatient clinic, where they go inside the bladder and remove the stent by a special telescope. Again, this is not painful. It is associated with very minimal discomfort, and the patient will go home within an hour after the procedure. What to expect with ureteral stent? The stent itself may be uncomfortable. As we discussed, the stent will be part in the kidney, part in the ureter, and part in the bladder. So each part of these can cause some pain. So you can have some kidney pain, some bladder pain, and sometimes even pain in the urethra. Also, you can have some blood in urine, and this is expected. I have my patients get alarmed when they see blood in the urine. Don't be alarmed, that is expected. You had a procedure, and this procedure will end with some blood in your urine. Frequently, you're going to have frequency of urination, some urgency, some leakage with urgency, some discomfort with moving around. All of these are expected, and all of them are temporary and will be relieved after you remove the stent. How can we deal with the stent discomfort? As we mentioned, the stent can have some bladder pain, bladder spasm, abdominal pain. Most of the time, these can be managed by the regular pain killers. Tylenol, ibuprofen, any of the over-the-counter pain medications. Bladder spasm, you can have some of the over-the-counter bladder spasm medications. These can turn your urine to orange and help to relax the bladder. If you have more of the bladder spasm, you can discuss with your urologist who can give you some medication for bladder spasm. However, not everybody is candidate for those. If you have blood in urine, it's not a big deal, as I mentioned. However, if you have a lot of clots and you are not able to pee with that amount of clot, then you need to contact your urologist and make sure that they know that this is a problem, because this may need to have additional treatment. Like anything with medicine, everything may have some problems and some complications. I usually tell my patients, you have to call me or call your urologist or come to the ER if you have any of these situations. Number one, fever and chills, especially if it is high-grade fever, more than 101.4, then you will need to call me immediately or come to the ER immediately. There is no hesitation about this. If you have persistent pain after attempted pain medications, and the pain is associated with nausea, vomiting, then you have to tell me or tell your urologist, or even come to the ER, because there might be something else going on. If you have heavy bleeding with clots and you cannot pee, you also need to let your urologist know. When the stent is removed, what do you expect? You may have minimal flank pain, you may have some bladder pain. However, these are temporary and will resolve within a day. Blood in urine can last for about a week, but it's not going to be heavy, and this is expected. You may have some increased frequency, maybe urgency, but all of these are temporary and will be resolved, and the medication we discussed earlier can help with these issues. Finally, I hope that short video will help you to understand about the stent and the management of the stent and the potential problems that can happen with stents. Please feel free to ask me any questions, and wish you the best of luck.